Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with bilateral, fully occluding, really dry, hardened and crusted earwax. And this is their left ear. Now to me, this dead skin looks like it's been pushed in. You can see the indentation actually. And another giveaway clue is that there's quite a few hairs matted up against the surface of this deep wax. And that's quite typical when patients poke and prod. I did ask the patient, but they were quite insistent that they never. So who am I to question them if that's the case? And that piece I was trying to remove, it is right up against the eardrum. So I've decided to come out, instill some medical grade olive oil spray. And what this will do is just soften the surface of this dead skin. And it will also allow me to get a slightly better suction grip. When you've got really dry, hardened, crusted wax or dead skin, it's very difficult to obtain an airtight seal with the suction tip. But if you soften it just enough, it allows the suction tip to grip and create a seal all the way around the edge. And that then maximizes suction power. And as I'm bringing this out the ear, you may see I'm just giving it a little wriggle. So I'm using little round circular movements, and that helps just to separate the plug from the canal wall because it's still attached. So that flesh to the right, that's the first bend. So we are making good progress here. I can just feeling it getting trapped in this region. So this is the isthmus. So the region between the first bend, the fleshy part on the right, and the fleshy part to the left, that's the first isthmus in the ear. So an isthmus is a narrowing. And we have two in the ear. We have one between the first and second bend, and also one a bit deeper, just about 0.5 centimetre away from the eardrum. And quite often, wax, particularly if it's been pushed in, it can get trapped in that isthmus and make it a bit more tricky to remove. So I've just lost my suction grip there. So I think I'm going to just go a bit higher up to see if I can get a slightly better grip on this part of the wax. And as I'm suctioning it again, I'm just trying to leverage it towards the entrance. Now, this is actually out of the ear. So to the left, those hairs that you can see, that's the tragal hairs. Before you enter your ear canal, you have a flap of cartilage, almost triangular shaped, before the entrance, and that's the tragus. And you quite often get hairs there. So this is that skin I was referring to that was attached to the canal wall, and it's as I pull the plug out, there's a tail of dead skin. So I'm just going to attach onto the dead skin. I have got a still image of all the dead skin that I removed. So I'm just going back in, getting a grip on that skin and slowly bringing it away. I'm going to just stretch open the ear. I'm going to reorientate the WAXscope towards the eardrum. I'm going to also increase the brightness now. I initially decreased the brightness because we're getting a lot of glare and reflection. And you can see that narrowing deeper in the ear. So the canal wall to the left, the anterior canal wall, it bulges to the midline of the ear canal and it causes a narrowing. So this is their right ear, and this is actually a bit more blocked. And again, I'm just going to the bottom of the ear canal. This doesn't look like it's been pushed in, however. So it was their left ear that they had more symptoms from, although there was more wax or dead skin, should I say, in their right ear. But the difference is in the left ear, it was really impacted up against the eardrum. That left ear was also narrower. This right ear, you'll see once I've removed the plug of dead skin, it's a bit wider now. The skin here is a bit softer, but the olive oil has a similar effect. It helps to bind soft tissue together somewhat, so it helps it to coagulate, and then it allows me to get a better suction grip. And it also ensures the plug of wax or skin, wherever it may be, generally comes out more in a plug instead of smaller pieces. So there's some skin to the right that's enveloped the wax or the skin plug, which is still adhered to the canal wall. And again, these little wriggle movements, it helps to elevate that skin off the canal wall to free up and mobilize the plug of skin. So I'm doing the same thing, but on the back canal wall. And as I bring this out the ear, you'll see a long tail of skin that's encased the entire ear canal. So managed to bring that first plug away. So we go back in. Now there is an opening now, so the patient can hear significantly better, but I wanted to get this dead skin out for them. So I've reverted to the 17 gauge suction tip. Don't really need the power of the 14 gauge to remove this dead skin. And because the ear canal is now more or less unoccluded, it's going to be a lot noisier for the patient. So having a 17 gauge suction tip, it's less suction power, but also less noisy. So with the gauge system, the higher the number, the smaller the tip is. Now that's that skin. You can see it peeling away in the distance of the canal wall and also possibly off the eardrum. Yeah, there's a bit there that just came off the posterior superior quadrant of the eardrum. The oil again has helped to soften this dead skin. So I'm just going more to the roof and to the front part of the ear canal. I'm going to peel that down and also trying to get it off the anterior canal wall. So again, I'm just using these rocking movements to help separate that skin. So the eardrum is fully visual now, but there is still a bit of skin around the periphery near the entrance, so we're going to remove that. So this ear canal is a bit wider, you get a better view of the eardrum, which looks nice and healthy. So there's a bit of skin there at the roof. I'm going to just get the WAXscope in focus. So with the WAXscope, when you're trying to get an object in focus, unlike an ENT microscope or head-worn loops, where you're having to either reposition the microscope, the optical unit, or in the case of head loops, move your head backwards and forwards. With the WAXscope, it's just a slider on the app, on the screen, and you just simply adjust the slider, or you can double tap the screen and it more often than not gets the object in focus. So there's a little bit left here. I think we got a bit of clarinetting at this stage, so after this I just stopped. So the underlying skin looks nice and healthy. You'll get another view of that in a moment. That's the eardrum again. And that's a still image of all the dead skin that I removed from both ears. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.